Good morning, dear students. Today we are going to learn about why do we fall ill. This chapter deals with what is health, what are the factors affecting the health, and opposite to health is called disease. So what is disease? What are various classifications of disease, type of disease based on various factors like infectious, communicable, non-communicable, acute, congenital, various types of disease that we will see. And lastly, how to get rid of this disease, means the treatment, and how to prevent from further attack of disease, those things. So these are the three important topics that we want to cover today. Students, so if we start with disease, but before disease, we have to understand what is health. So health is a term used for indicating the personal happiness. When the person become happy when he is socially, mentally, physically healthy, or when the person have social, mental and physical well-being, then the person will be happy. Then he is saying that the person is having good health. So the health or healthy means the person is physically fit, then mentally fit, then he is not having any kind of anxiety. Say it appears that you are looking physically fit, you are also mentally fit, but you are always under anxiety or you are always thinking something at that time. You are not called as having a good health, because mentally you are not fit, you are full of anxiety. So the prime requirement or the definition of this health is like this. So health is a state of physical, mental and social well-being. So right, it is a state of physical, mental and social well-being. So this include all the three things. One is physical, another is mental, another one is social. See, what is this? It means a person is said to have a good health or possessing good health if the person is physically fit, means for good health, one must have or one must be, the very first one is physically fit, physically fit means he is having all the required organ, part, limb for their survival of good life. Like the human being have arm, legs, ear, whatever the organs are there, means physically he is good. So possess all means having all organs or limbs, and he is able to adjust in the environment or in their nature where he is surviving, and adjust in physical environment. Means the person must be able to survive in their environment under the normal condition. The second requirement for this is mentally fit. So mentally fit means he should be able to think properly or think rationally. So means mental health is required. So mental health and rational thinking. Rational thinking. Like you might be observing that in our society there are certain persons who are mad. So what they are physically fit but mentally they are not fit. So this mental fitness is equally important. The third one is the person must be free from anxiety. He is not always thinking something. So it is the part of your mental fitness. So free from anxiety. From anxiety means no mental tension. Mental tension. Okay, but do not think just you are thinking for your study, that is a mental tension. No, that is the part of your life. So these three are the prime requirement for person to have a good health. Okay, so for perfect health these three requirements are must. Now ease means physical well-being. So this health simply means well-being. When you are well-being means you will be happy or happy life, but means you are comfortable life or comfortable life means life is easy. But there are certain situations when a person start irritating and he feel that the life is not comfortable. Like if you have continuous pain in your stomach, then you are feeling uncomfortable. So these uncomfortable situations are called as disease. So students, this disease are nothing but disease are the uncomfortable situations. So right, the next term called disease. Students, this disease itself indicate it consists of two things, dis and ease. Ease means easiness and dis means disturb. So when your easiness is disturbed or easiness of life is disturbed or comfort of your life is disturbed, then it is called as disease. So it is your like disturbed easiness or comfort of life. Get it? Means what? The comfort of life. The comfort of life is what? Health. That is, the health is disturbed. So disease is what? Unhealthy condition. So unhealthy condition of any organism is called as disease. Means it is reverse of, it is opposite of health. What else can be written? It is the situation where the comfort of life is disturbed. So it is the situation or malfunctioning or poor functioning of body organ. So this situation where the comfort of life is disturbed. That is, personal well-being is disturbed. It simply means when it arises. So this arises when some of the organ of the body is malfunctioning. So it is malfunctioning. Malfunctioning means not proper functioning of the organ of the body. So it is malfunctioning. It is malfunctioning of body organ. Now this malfunctioning of body organ means not proper functioning, that is not proper functioning of one or more part or organ of a body or organism. This is called as disease. A student, so what is this disease? Disease is simply means you are not healthy. So just opposite to health is called as disease. Now what are the factor? Means if the person is healthy, we can say he is free from disease. If the person is having disease, means he is not free from the malfunctioning of its organ, means the person is said to be have not good health. So health means must be free from disease. These are the conditions required for good health. So physical well-being, mental well-being, social well-being, free from disease. Opposite to health is called disease. Now what are the factors that leads to this health or that affects the health and leads to disease? So let us write factors affecting health and leads to disease. So what are the factor, what are the cause because of which the disease arises or condition under which the disease arises? A student, why the disease? Disease is what? Malfunctioning of one or more organ of a body. Why this malfunctioning can arise? A student, it may be possible that if we are not taking proper nutrition, means malnourished, then some of the disease may attack us. Getting? If we are not physically fit, for physical fitness, what is required? Sufficient amount of nutrition or healthy food or balanced diet is required. If that is not there, then the disease may attack. You become very weak and the disease may attack. Other one in your society where you are living, if the neighbors are not handling their waste properly or their garbage properly, if they are throwing their waste just to the nearby area or just on the road and water drainage are not properly covered, then the society or environment around us get disturbed, and that give rise to means the open drain and various garbage here and there, that leads to formation of various pathogens that enter in our body and that give rise to various disease. So this way the society means the social factor is a factor. So broadly we can say there are two kind of factor. One is called personal factor, another is called as social factors. So student, the total factors affecting health, let us divide it into the two categories. One is called as personal factor means the individual factor also may be called. So personal or individual factor. The another one is called as your social or community factors. So for personal factor, what are the factor required? Means good food or healthy food. So this healthy food, when we can earn, we can get if we have sufficient money to buy the milk, buy the fruit, because this milk, fruit and other thing are the ingredient of our balanced diet. If we are not taking all those things in our balanced diet or in our diet, then we may fall ill, means we may not have the good health. So this having disease is called fall ill. Okay, student. So this personal factor also called as your economic well-being, to have good nutrition. Nutrition means healthy food, or this is also called as balanced diet. Okay, means whatever required. So for the having good health, we need sufficient amount of money to have a balanced diet. So economic well-being, to have good nutrition, health or healthy food or balanced diet, to avoid malnourished, to avoid malnourishment. Means because of the food, the person is looking lean and thin. So that condition should be avoided, because no sufficient energy in the body, that leads to poor functioning of the organ, and ultimately poor functioning of one or more organ leads to what? Called disease. Okay, so it is this. So economic well-being is very much important. Economic well-being means sufficient money is required. It simply means sufficient money is needed, or sufficient money must be possessed by each individual. So this is the personal factor. Coming to the social factor, in the social factor, student, or community factor, what is there? The physical environment around an individual. So first one is physical environment around the individual must be healthy. If it is polluted, say air pollution is there, that leads to various kind of disease related to respiration, means respiratory disease arises. So physical environment around the individual must be healthy, and free from the pollution, and free from pollution. This pollution may be your air pollution, or maybe your water pollution, maybe your land pollution. Like open drainage in your neighborhood leads to water pollution, because that drainage water may enter into the drinking water line. Another, their large means bad smell is coming from the drainage, that leads to the air pollution. Even the soil or nearby land also get affected, become marshy and bad, that leads to the land pollution. So all these are included in environment. So environmental pollution so must be free from environment. The second, your neighbor or community factor, like this cleanliness and hygiene is required to be maintained by each of the neighbor. So right, hygiene and cleanliness. So it is very important factor. So environment should be hygiene and clean. So how your environment will be hygiene and clean? It could not be only alone by an individual, but all the person in that society need to have awareness. Getting? So good awareness among the society. So good awareness and education or literacy. If the person is literated, then he can understand unhealthy environment leads to various disease. So that's why good awareness about the health and literacy is required among the society. So society includes all your neighbor and everything around you. Okay. So the physical condition, one important. Again, the next one is hygiene and cleanliness. The third one is your awareness and literacy. So these are the various factors. If all these factors are taken care, then the person will be healthy. So if these factors are not taken care, then person may fall ill. Okay, students? So right, if above factors, what are the factors we have written, as student? The very first we have written at the individual level, social well-being. The next one is their physical environment. Third one, hygiene and awareness and literacy. All these things. So above factor or failure in above factor are needed for good health and avoid disease. Okay, if the above factor are not maintained, then that leads to disease. Okay, now the question is that how we come to know about the disease. So that condition is called as symptom. So how to know about disease? Means a disease have occurred to individual. So to know about the disease, this is called as your symptom. Symptoms. Symptoms simply means the characteristic that tells that the ease of individual or the health of individual is disturbed. Means he might be suffering from some of the disease. So different disease have different characteristic, means different symptoms. Okay. So student, what is the symptoms? The term symptoms are asked to define. So symptoms, so these are the features. These are features or characteristic which indicates a disease. Health is disturbed. That is, person suffering from disease. That is, organism or the person suffering from disease. So indicator of disease is called as symptom. Okay, simply means it is, in simple word, it is indicator of disease. But which disease is that? For determining the exact or pinpointing the type of disease the person is suffering is determined by the pathological test. Okay, so it is indicator of disease. What are the common factors that coming across or that is observed while the person is not healthy? Like, while you are in fever, the temperature of the body get rises, the headache or pain get arises. So these common features are called as symptoms. So write down the example. Their example: rise in body temperature, rise in body temperature. So rise in body temperature indicate what? The person is having fever.
Fever.
Now, student, this fever could be under the various condition. It may be because of the common cold also, because of the malaria also, because of the kalazar also. So fever is the common symptom for many kind of disease. But whether this fever is the influenza fever or common cold fever or kalazar fever or malaria fever, so these kalazar, malaria, common cold, these are different kind of disease. So for that even more other tests are required. So just one of the factor is rise in body temperature. The other one, yes, can you tell me, a student? Few more. Like, if the person along with the fever is having the cough, and that cough sustaining for very long time, then he might have some other kind of fever. Okay, other kind of disease rather than common cold. So like the cough is the common feature for common cold. So cough. The third one,
Stomach ache or headache.
good. So maybe and headache. Okay, so having this headache means head pain, stomach means stomach pain, all this. Stomach ache, it is stomach pain. Sorry. So it is your stomach pain. So these are the common thing. In addition, there could be the loose motion. It is, yes, good. Vomiting. So under certain condition or in certain disease, there could be the vomiting also. Getting? So these are the symptoms. So student, what are these symptoms? Symptoms may be common for more than one kind of disease, and particular kind of disease are determined by pathological tests. So right, that is important. So symptoms may be common for more than one kind of disease. And the particular disease is identified or pinpointed by what? Lab test or pathological lab test in hospital. Getting now? So these are these common symptoms by which we come across. Example, even if we consider malaria and kala jar both having fever, even the common cold also, but the fever of malaria or rising body temperature of malaria is different characteristic than rising body temperature of kala jar. There are certain other characteristics by which we can determine, though these kala jar and malaria are of the different kind. So symptoms are what? The characteristic or feature that indicates the disease. Okay. So after coming or after knowing these certain symptoms in our body, we are going to the pathological test or hospital where we are diagnosed. Okay, student. Now, how to get rid of this disease? So, how to get rid of this disease? What are the various types of disease that I will tabulate? A student, so once you fall ill, then you have to take proper treatment. Take treatment. This treatment starts after knowing the symptoms. Okay, now student. So take treatment on symptom based. Means taking treatment on symptom based medicines. One is this, to get cured, to get cured from the disease. Another, there are certain ways of avoiding the disease. So first one is this,
vaccination.
yeah. So the other one is called as immunization or vaccination. So the better one is prevention of disease. So these have the first step treatment occur after this symptom, means once the disease have occurred. There are certain ways by which we can prevent it. So prevention of disease. Before its attack or before its occur. Before its attack. Okay, student? So prevention is always preferable. How to prevent? So this prevention can be done by the factor that we have listed earlier. So this can be done by avoiding condition that leads to disease. What are the conditions that we have listed, student? These are the 5 conditions. Okay, these are the conditions that we have listed. So under these 4 or 5 conditions, you can avoid the disease, you can prevent, avoiding prevention of disease before its attack, condition to occur disease. The second one is immunization and vaccination, means develop your immune system. So immunization and vaccination means vaccines are given to avoid the possible attack of the disease. Example that you are getting that BCG or polio vaccines or immunization. So it is given to the newly born baby or to the children for their attack throughout their life. So in life, that polio or this BCG, this bacteria or this disease should not occur. Getting a student? So this immunization and vaccination are the method of prevention. Now, a student, it is always advised that this prevention, write it, prevention is always better than cure. Prevention is better than cure. Means though once the disease have occurred and you can take the treatment and you may become fit, but still it is advised you should prevent or avoid the attack of disease. Why? Yes, student, can you tell me? Very common thing that once the disease have occurred to you, certain cells are getting damaged. Though you get cured, but you cannot recover to the original as it was. Like once consider the bone or one of your bone get fractured. So can it have exact strength as earlier it had? No. Once the bone get fractured and after treatment it get recovered, but still that bone remain weaker. By the lesser force, the attached bone or the recovered bone may break again. So that's why, because this prevention is always better than cure, because the first one is disease always causes harm, and even after recovery it makes the organ weaker. So even after cure of a disease, the organ or the part of body become vulnerable to further attack or become weaker. Getting a student? So this is the main cause. That's why it is always advised. Another, the second one. So this treatment needs large cost in terms of money, in terms of the time that is being taken from the individual. So treatment needs use what? Cost. Third one, disease leads to wastage of time. So disturb or even waste the time of individual or precious time of individual. Getting? Like once you fall ill or you are having the fever, Did you people read or paying same attention to what you are studying as when you were healthy? No. But once you have lost that 1 week or 2 week, you become lacking with respect to your friend. So that leads to loss of time. So because of these factors, it is always stated that prevention is better than cure. So this statement is asked. So you have to say why prevention is better than cure. Okay, student? So these are the things related to our disease. So here we have learned what is health, what is disease, then factor affecting the disease, then their symptoms, then their treatment, why prevention is better than cure. Okay, student? So the person is having disease is also called as fall ill. Okay? So this disease means suffering from disease is called suffering from disease is called what? Fall ill.
Fall ill.
Get it? So the term or topic like fall ill simply means the disease that we have to understand. Okay? That is fall ill. Okay, so fall ill or disease mean the same thing. So ill can be particular organ or even fever or any kind of thing. So this is all about. Now we have to understand what are the various types of disease. This is the important topic from where the questions are framed. So various types of disease. So right. So various types of disease. This is also called as classification of disease. So these classification help in understanding why the disease arises, which kind of treatment is required, what are the factors. So based on that. So it is based on various factors. So depending on the factor, it can be of the various types based on various factors. So first one is based on duration of existence of a disease. So various factors like how long the disease persists in the body of a patient, considering that. So like duration of disease, another whether the disease is by birth or have occurred after the birth. So by birth means on inborn or after that the disease have occurred. There are various other factors like whether the disease is transmitted from one person to another or not, like communicable or communication or transmission, communicable or also called as infectious, whether it is infecting the other fellow who are in nearby of that patient or not. So etc. Many more are there. So broadly there are 6 such factors. So we will learn about 6 kind of classification. Okay. So I will discuss their the various types, their example, their cause, everything in that. By that way we are able to finish the topic. Only this much thing we have to learn. A student, so we have to learn about disease based on, so one by one we are going to discuss. So disease based on the duration of existence. Duration of existence means what? How long the disease occur in the body before it is getting cured. So based on this duration of existence, the disease can be classified into two categories. One is called as your acute disease. These terms are very important. Getting a students? So what is this acute disease? It is asked, define acute disease. So first one is our acute and chronic. Acute disease, and the second one is called as chronic.
Chronic disease.
Yes. Chronic. A student, this is the classification based on duration of existence. So if the duration of existence of a disease means the disease is occurring for short time and just within a day or 2 days or within a week, if it is getting cured, then that kind of disease is called acute disease. Example, the common cold, the common flu or influenza that we are getting, and just after 3 to 4 days we are getting rid of that, we become healthy and we can start our work. So this common cold is what? Acute disease. But there is other category called chronic. Chronic means the disease which have very long gestation period or long time of existence. Example, you have heard certain persons are suffering from diabetes. So for cure of diabetes, it takes so many years. Even sometimes it is also not getting cured. So diabetes is what? Is a chronic disease. Maybe the tuberculosis, maybe the cancer, all these are chronic. So right, acute disease, disease which have shorter period or shorter duration of existence, that is in short time it get cured. In short time around a week or month, week or even months also get cured. The disease get cured. So this short time means hardly up to a week or a month, but not longer than a month. Then it is called as acute disease. Write down the example. What are the examples, student? Like your influenza or common cold. Common cold. So just after a week, taking some medicine, you will get cured. The common fever, not the malaria fever and other. The common flu or influenza or flu, means flu is also in this category. These are. So here we are observing in short time, these diseases are not affecting our body too much. We are not getting very much lean and thin. So it do not though slightly we are getting affected, it do not affect health too much. Get it? Slightly, just within a week, your weight loss or other thing will not happen too much. Hardly some amount of losses are there. Getting a student? So do not affect health too much. Now coming to the chronic disease. So what will be this chronic disease, student? Disease
Longer
exists for a very longer time. So it have very long duration of existence in the body. Son of existence in body of a patient. Okay, student. So this duration of existence is sometimes also called as gestation period. Okay, student. So sometimes this gestation word is also used. So we can write that is longer gestation. This term may be coming in your examination. So period. Rather than writing that much bigger, only the gestation word is used. So in acute, what this have? So this have shorter gestation period. Gestation means the period of existence. That is called as the gestation. Okay. So this, let us write down example. It could be your cancer where the cell gets damaged abnormally, either grow abnormally or destroy abnormally. That is called as the cancer.
asthma.
Yes, asthma, the TB, tuberculosis, yeah, asthma.
Polio.
Very good. The other one is the diabetes. Okay, these are the few examples which have very longer duration of existence. Because of its longer duration of existence, it disturb or it destroy the body, or it affects or disturb the body too much. Getting now? So too much suffering, that is too much suffering. So in which case the suffering will be maximum?
Chronic disease.
Very good. So this term are asked. So based on this suffering also, the suffering is too much, it is the chronic, and if the suffering is to lesser extent, then it is called as acute. So this is the first classification. The next one is disease.
Sir, can you scroll down?
Write quickly. These are very important. So you have to define what is chronic disease, give its example, what are its consequences. So consequences means the effect over the body, that is too much. So all these things you have to take care. You have to understand point wise. So that's why
Yes,
I'm
sir.
writing everything point wise and in systematic manner so that you can write it properly. Okay, student?
Yes, sir. Done, sir.
So now let us go for the second kind. So second one is disease based on since birth or have occurred after birth. On since birth, that is inborn or after it, means after birth. So there are certain diseases which occur since birth of a baby and it persists either throughout its life or for a very longer time. So such a disease which have occurred since birth, they are called as congenital disease. And certain other disease which occur after the birth during any age, they are called as acquired disease, means have occurred or get trapped by the disease. Getting? So based on this, since birth or not, so based on this, it can be classified into the two categories. The very first one is called as congenital, basically disease. The next one is category is called as the acquired disease. So student, if anyone is asking to you what is congenital, so first point in your mind that comes shall be the disease which has occurred since birth. So that is existing in the patient or in the person since birth. There are certain diseases which are not since birth but have occurred because of the various factors in their environment or to the individual factors. They are called as acquired disease. A student, so congenital disease and acquired disease. Now this acquired disease which occur after the birth, so this is inborn and this is after birth it had occurred. This acquired disease or this disease which occur after the birth may be because the person is coming in contact with other patient which is already having a disease, means it is because of communicable disease or because of infection from the other person. So it can be again infectious or non-infectious. Okay, so it can be, first one is our, write down a small one, because of the communicable disease, means certain disease which have occurred or which is occurring in other patient and the same pathogen have occurred into the healthy person, that way the disease occur to the healthy person. So such kind of disease is called communicable disease.
disease.
Or also this have what? Infectious disease.
Infectious disease.
That can infect the other. Like commonly you are observing, I get infected by the virus, by the bacteria, by the cough, all these things. Okay, students? So communicable or infectious means the same. Infectious disease. A student? So this communicable or infectious because of certain factors that we will see again. Other one is non-communicable, but that have occurred because of the lack of nutrition in the body part itself. Getting? Like diabetes. If you are coming in contact with the person having diabetes, the diabetes will not occur to you. And diabetes is also not by birth. But if our pancreas stops working, then the diabetes occur in any individual, and this occur most commonly after the age of 35 or 40. Getting? So that kind of disease are not infectious, but they are also acquired. So right, the second category in acquired one is non-infectious or non-communicable or non-infectious. Okay, student? This classification, once you understand, it becomes very easy to give the definition and understand and write the symptom of that disease. It is this way. Further, if you go for the communicable disease, you will get various classification that we will also see. So this communicable disease may be the direct transmission or indirect transmission. This we will also see. This may be your, we may further write as A and B. It is called as direct. This is also called as transmittable. Okay, now? So get transmitted. So that occur by transmission or get transferred from one another. So direct transmission or indirect transmission. Direct transmission means once you come in contact with the person, then directly it can occur to you. Like the person is having TB or asthma, and if you are coming in contact of that, then the droplet coming from his mouth will enter into your nose, and that causes the asthma and TB to you also. So that is called as the direct communication or direct transmission. Okay, so this we can write here, occur by contact. Occur by contact. Contact doesn't mean always touching, coming closer to each other. Contact, getting its droplet from the mouth or getting the droplet of what? The air coming from the mouth or sneezing
Sneeze.
or the cough. Yeah, so getting droplets of from the infected persons, or these droplets may be falling on some other substance like the hanky used by that patient, and you are using the same hanky, that may also leads to this kind of transmission. A student, indirect transmission are what? Those transmission, not direct contact, but there are certain carriers which are able to carry to you, like housefly or mosquito. If the mosquito is taking the bite to a patient, and then the same mosquito is cutting the or biting the healthy person, then the healthy person fall ill. That kind of transmission is called as indirect transmission. So this can occur by the air or water or even the soil also, or vector. This vector is what? The carrier, that is called as the carrier. This vector, like mosquito is one of the carrier, so vector. So these conditions, they are called as indirect. Example, mosquito bite. Mosquito bite. So mosquito who have taken a bite to the patient, and then the same mosquito is taking the bite to the healthy person, he will fall. The healthy person will also fall ill. So this kind of, so there are certain infectious agent. So infectious transmission, there are certain infectious agent or causing agent in this case. Okay, so in this there are certain infectious, infecting or causing agent is always there. Here we are getting the agent is what? Water or the mosquito. So based on the various agents, this mosquito or maybe your virus or maybe your bacteria, etc. These are. So we'll understand all these things. So what are these infectious disease and non-communicable? So now let us come for explanation of each and every topic. So what is this congenital disease? So write 2A. Means in second, the very first we are going to write for the congenital disease. Okay, student? So put the heading in the same manner as I am putting, so that we can quickly identify. So congenital disease, congenital, congenital disease. So what is this congenital disease? So inborn disease. These are inborn, that is occur by birth. Such diseases are called as congenital disease. There may be certain things which are genetically transmitted disease, means from the parent it get transmitted to their younger one. Like if the parent have AIDS, the younger also get the AIDS. Okay, many more diseases are there. So maybe genetic means the parent have that kind of gene and the same gene is transmitted to their younger one, so the younger is also getting the same disease. So that is called as genetic or hereditary. So genetically transmitted disease, this congenital disease are also genetically transmitted disease. What are the example? Let us take. Or maybe genetic or maybe not in parent, but by birth it have occurred to the children, because while from parent to the children is formed, certain genes are copied or almost all genes are copied from their parent to form their younger one. But while copying the gene from parent to the children, certain alteration may occur. Like if you are copying a notes from the note of your friend, you are observing that certain words or certain spelling mistake may occur. In the same way, in nature also, even the baby is going to take birth from their parent, but the baby is not exactly matching with their parent. Why? Certain changes in their gene occur. So while these certain changes occur which are not favorable or not give to good health, so that kind of unhealthy situation give rise to congenital disease in the children. Let us write down the example. Example, like certain children or certain person cannot identify the difference between the color, like this is red and green, of minor contrast. Okay, So that is called the color vision or color blindness. So it is that kind of category. Another, so let us write this color vision or color blindness. Color blindness is what? Color blindness, the person is not able to differentiate between different color of minor contrast. It is also called as color vision. Other, it can be the blood cancer called hemophilia. Sorry, the blood alteration, hemophilia. So the person once get the wound, that wound doesn't get healed easily if the children have this hemophilia. There are certain other kind of the cell of the baby is not proper, that is called as the sickle cell anemia, means the skin is not healthy, skin always having the patch, or skin is like the very thin sickle like structure. So sickle cell anemia. Anemia, etc. Many more are there. So these things we have to understand about the congenital disease. Now let us come to the acquired disease. Student, in parallel I am writing the acquired disease to be acquired disease. So the easy, what will be the definition of acquired disease? That occur after the birth, after the birth of children or baby in their life. Example, say the common cold, fever, all these things are what? Acquired disease. Getting? Even the diabetes, even the cancer, even the common cold or the flu, even the weakness because of malnourishment. If the baby is not given the proper nutrition, then their bone get curve shape, that is called as the rickets. So right, rickets or PEM, the better term is PEM, protein energy malnutrition. These are called as your acquired disease. It may be your cancer which occur after, it may be the TB which occur after the birth, it may be malaria which was not during the birth but have occurred after the birth. So it may be diabetes, cancer, TB, malaria, may be communicable or non-communicable, maybe your the twisted bone or bigger domain with thin body structure, that is called as quasi-archer. Quasi-archer, maybe your, so these are your acquired disease which have occurred after the birth. Here we are getting diabetes, cancer, these are non-communicable, but TB is communicable. Even malaria is also communicable, carried out by the mosquito. So here we can write these are non-communicable, this quasi-orchid, rickets, PEM, these are non-communicable, but this TB and malaria, these are communicable. Therefore, this acquired disease can be written as, it can be infectious. We had already written, a student, the same thing we are writing. Infectious or non-infectious. Infectious or communicable mean the same thing. Or non-infectious. Okay, student, it is this one. So maybe you're infectious or non-infectious. It is this one. So we have to understand about what is infectious disease, and their name we also have to write for this category. So let us go for the communicable disease and non-communicable disease. Here we will cover it. So write down the heading to be in that the first one. Okay, student, communicable disease. Also called as, what is the other name, student? Just now we have learned. So it is also called as infectious disease. It is caused by certain external agent, or it is caused by the passing of disease from one person to the another. Caused by passing of disease from one person. What is this one person? He is the patient to other or healthy person. So such disease which passes from the patient to the healthy person is called as communicable disease. Student, we can write down the example. Example, the TB means tuberculosis. So what is this TB? Means continuous cough and bulgum coming from the patient mouth. It is a kind of respiratory disease that contain the various microorganisms. When the other person coming in contact with that cough or that area, then the other person will get infected. So student, it is like this. We can understand this situation is like this. So let us take this. So here the person having the TB is, while he is coughing, then he will release certain micro small vapors or the droplets. So these droplets, you are getting that small droplets that coming from the mouth, that will spread nearly 2 to 4 kilometers, 2 to 4 meter. And if the other healthy person is coming in this region, then this TB get spread. Okay, student? So it is this one. So it is the droplet get transferred to healthy one. healthy person. So TB is a respiratory disease of continuous cough. I hope you people are knowing that. Another, the typhoid fever. Typhoid fever or the typhoid itself. The third one, the hepatitis and jaundice, which is quite common. So in jaundice, the body of the patient become yellow, the liver stops working. This jaundice is a kind of hepatitis. It is this one. The other one, malaria. All of these are communicable disease. A student, this communicable disease, how it gets transferred from one person to another? So it is transferred or transmitted from one person to another by, so either here we have observed that in first case in TB it is the small droplet that goes into the air, and that air taken by the healthy person, the other healthy person will also get suffering of the tuberculosis. Typhoid, the mosquito. The jaundice, the water. The malaria, if a mosquito, if the mosquito is taking a bite from the person or from the patient of malaria, and the same mosquito is taking bite to the healthy one, then the malaria virus get, basically malaria protozoans get transferred from the patient to the healthy one. So this transmission from one to another occur by, so it is transmitted from one to another by the various routes, by various routes, or by a small microorganism, a small organisms called vector. They are basically the pathogens. Better term, let us first write the vector. Like it may be your virus, maybe your bacteria, maybe your fungi, maybe your protozoa, maybe your mosquito, etc. Okay, so it may be by the small microorganism, or maybe even by the air itself, so by various routes. Getting? So how is this transmission? So based on the transmission, there are different modes. So what are the various modes of transmission? That we can also write. A student, in this figure, the various modes of transmissions are given here. So let us just copy it. So what are the various modes of transmission that can be observed from this figure? Yes, students, observe this. And please note down the 4 or 5 modes of transmission from the infectious person to the healthy person. Can you write? Surely, I hope you people can understand. So see, yes, this communicable disease may occur through the direct contact. So here we are through the various routes. So these various routes can be the direct contact, there are certain disease while you are coming in contact or touching the other person, the disease get transmitted. Example, the AIDS. These AIDS doesn't come directly by touching the skin of the other, by the sexual contact or the contact with the blood serum coming from one person to the another, this can occur. So these are the example of direct contact. Then it may occur through the air, or maybe your air or water, or maybe through the land or the material used by the land or soil also, or the goods or the substance used. Like see here, indirect contact are what? They are the used cloth, means the one person is using, then the other person is using the cloth of the infected person, then the germs of the infected person get transmitted to the healthy person, like during the food and all these things. So it can be direct contact or direct transmission, and these are your indirect transmission. Are you getting? Or it could be because of this certain small insects like mosquitoes and small pathogens and virus. So here are the three kind of thing. So first one is direct transmission, the another one is your indirect transmission, and the last one is transmission by the vector or a small organism. So right, transmission by vector or a small organism, or insects or a small organism. These things we have to just understand. So these are the further three categories where we shall keep in mind. Like for direct contact, what could be the example? The example could be AIDS. The example could be your direct coughing, TB. The indirect contact, while the cloth or the used item of the patient is carrying the pathogens. Pathogens are the small microorganism which is able to cause the disease. It could be that one also, or used item of the food, plate, etc. Another directly the microorganism or vector is causing the disease. So these are the three modes of communicable disease. So what are the modes of communicable disease? I have also written it here. So their example you must write, and this we are going to discuss about this in a bit more detail. Students, so this tuberculosis, typhoid, jaundice, malaria, other one is amoebosis also, means amoeba, amoebiosis, that one also. This communicable disease can be further classified into causative agent. So these are what? Causative agent. These are the, whatever the small insects or mosquito, these are called as causative agent. Causative agents. Now this causative agent may be again your viral, bacterial, mosquito, this thing. Maybe your bacteria or virus, which is quite common, like COVID virus, okay, COVID-19, the coronavirus that you are observing nowadays. It could be that one. It could be the bacteria, or it could be the fungal, like the ringworm or roundworm develop in intestine, or pinworm that develop, they are the fungal. Right? So this causative agent based can further classified into the three categories. So these things we will also learn. Now let us go for the non-communicable, then we will come for this based on the agent. So 2, then B, then the second one called non-communicable disease, or also called as non-infectious cause or disease. So these are not spread. So it earlier was what? Transmitted or spread, that we have written here. So passing, that is, it is spreading from one to another. But there are certain disease which are not spreading, means it remain confined to the patient itself. So right, it do not spread, or it do not transmitted or passed or transmitted from infected person infected person is what? Patient to healthy person. So if the situation is like that the disease is not transmitted or not passing, then such category of disease are called as non-communicable disease. Example, the diabetes, occur to individual because of blood sugar. The sugar is not buffered or controlled in the blood. It remain confined to the patient. It will not pass to the other one. The second, write few more. Cancer also do not passes. The third one, if the poor health like kwashiorkor, marasmus, means if the person is very lean and thin, or if the children is very lean and thin, then coming in contact with that children, the other children will not also become lean and thin. Kwashiorkor, marasmus is also the similar kind. Marasmus occur in the children. The hemophilia, these are arthritis, means the joint pain, that is called as the arthritis. So these are the disease which do not passes from one person to another. Then how it occurs, student? So it arises or occur. Why? Due to internal disorder of one or more organ of that particular individual. Due to internal disorder, also called as malfunctioning of one or more organ of individual, or maybe due to lack of balanced diet or lack of balanced diet. Lack of balanced diet, what is that? It is called as malnourished.
Malnutrition.
Yes, malnutrition or malnourished. Getting a student? So this malnutrition means poor eating habit or poor diet, or certain organ start disordering, means malfunctioning, then this arises. Example, why this diabetes arises? Because pancreas is not able to give insulin. So in this case, pancreas in our body do not give the enzyme insulin. It is basically the hormone. Okay, now student, or we may write the enzyme. Or better term is hormone, so we shall write the hormone itself. Hormone insulin to digest the sugar. To digest sugar. That's why you are observing that it is always advised for the diabetic patient to not eat more sugar, because for the use of sugar by our body or digestion of sugar, the pancreas in our digestive system, it is auxiliary part of digestive system, releases the hormone insulin. So the person having diabetes are asked to take the external pills or injection to metabolize the sugar taken during their diet. Cancer, it is what? Confined to the cell. So this is cell division, faster division. Though the cell division have its own life, but if it is occurring fastly because of cell disorder, so it is cell disorder. Cell is not functioning properly in particular area, particular region. Do not say think all over the body, because the body have different kind of cells. Quasi-occur, it is your protein energy malnutrition. So PEM, it is if the protein is not taken properly in their food, then no sufficient energy will be given by that food, then the malnutrition or growth of the organ will not proper. So that kind of malnutrition is quasi-occur or marasmus. Okay, so it is PEM. The other one, hemophilia, means it is because of the blood. So blood platelet or blood clotting is not occur properly, so that the children getting the wound, the blood will not clot. It is that one. Arthritis, the bone or joint pain, means it is related to bones. So here we are observing it is because of the internal disorder, this non-communicable disease arises. Okay, there are many more. Maybe your vitamin deficiency like beriberi, pellagra, night blindness, all these are also non-communicable. Write few more. Night blindness. So it is lack of vitamin. Means in
Lack
twilight
of
or
vitamin.
in your night, the object will not be visible to the person. That is called as night blindness. So it is vitamin A deficiency.
Lack of vitamin A.
Good. Get it? So it is so many kind of disease which are non-communicable. So the important point, it arises to the individual itself. So arises to the disorder of individual itself. It doesn't come from external. So it can be corrected by proper functioning of the organ, by internal treatment of organ, by proper functioning of organ. Okay, student, I think let us stop it here. Only a small topic is left. 2 or 3 more such kind of disease are left. I think that I need half an hour more. I think next day we shall do. Let us stop it here. Otherwise it become too much for this single day. So we are left with a small topic of this chapter also, and the other one. So student, whatever we have learned and the new terms, the new kind of disease, their cause, their factors, these definitions are very important, and you please go through all this very carefully. Okay, so these things we have already finished. This, what is health, diabetes, their classifications, their treatment and preventions. Means prevention is better than cure, that I have also explained. So we are left with what is immunization, that I will explain. Only the definition is required, and 1 or 2 more 3 more classifications are there, that I will explain. Okay, student. So this was all about today class. Yes, student, any doubt then please tell me. By tomorrow I think we are able to finish this. Yes, student, any doubt?